Hello everyone, my name is Catherine Martinez and this is my Module 5 discussion board post. The scenario for this discussion is that today is Monday, and as every Monday, Victoria, a healthy but lazy young girl, has promised herself to stop being a couch potato and start an exercise routine that she will follow every single day. No, any resemblance to reality is pure coincidence. Well, Victoria puts her sneakers on, gets ready, and just starts to run around the neighborhood. She is all sweaty and her face has turned red. What are the cardiovascular changes taking place as Victoria jogs? As Victoria jogs, her heart rate increases to ensure more cardiac output. Blood vessels vasodilate, allowing more blood flow through them to supply the active skeletal muscles. Heart rate increases to send more blood to active skeletal muscles. More blood flows to the skin, making her face turn red. As for the heart rate, her heart rate increases during exercise. The active skeletal muscles need more oxygen, hence a higher cardiac output. The heart therefore beats faster than normal to supply the required oxygen for Victoria. The sympathetic nervous system releases the hormones catecholamines, epinephrine, and norepinephrine to accelerate the heart rate while she is jogging. As for the blood vessels vasodilate. This widening is due to the relaxation of the blood vessels' muscular walls. This enhances blood flow to the active muscles of the body. Her blood vessels are vasodilated due to increased consumption of energy, hence decrease in nutrients and production of more carbon dioxide. More blood flow from the heart is therefore needed. Coronary arteries are the blood vessels primarily targeted by these changes. Anatomy of capillaries and the pre- and post-capillary sphincters. The precapillary sphincters at her quadriceps muscle will be open to enable oxygen supply and dispose of excess waste products through increased blood flow, as shown in Figure 8 here. As for face redness, Victoria's face turns red as the body temperature increases, causing increased blood flow to the skin to sweat and cool off. This process causes the cheeks to appear more red. Jogging increases the energy demand for skeletal muscles, which redistributes the blood by a mechanism called the vascular shunt mechanism. More blood is supplied to skeletal muscles and less blood goes to other body organs such as the digestive system. As for the nervous system, the sympathetic nervous system increases heart rate. It releases hormones epinephrine and norepinephrine to accelerate the heart rate and consequently increase the cardiac output. Neurotransmitters being released in greater proportion is norepinephrine. As for the respiratory rate of Victoria, due to increased oxygen demand by the body, respiratory rate increases from about 15 times a minute at rest to 40 to 60 times a minute. As heart rate increases, respiratory rate equally increases, causing more oxygen to be absorbed in the blood and carbon dioxide to be removed. Bronchodilation occurs as the diameter of the bronchial tree increases. This is enabled by the airway smooth muscle located in the trachea and the bronchial tree up the terminal bronchioles. Bronchodilation is stimulated by the sympathetic nervous system through epinephrine. Immediate and long-term effects of regular cardiorespiratory endurance exercise. The immediate and long-term effects of regular cardiorespiratory endurance exercise are the notable increase in cardiac stroke volume and raised heart rates that elevate the cardiac output. Long-term effects of cardiorespiratory endurance are the increase of transient systemic vascular resistance that promotes the blood pressure in the arteries and reducing the blood pressure in the long run. The benefits of regular exercise for mental health and other organs, including osseous, muscular, integumentary, digestive systems, include improved endurance, improved sleep, increased interest in sexual activity, reduced stress levels, improvement moods, and increased stamina and energy. So as for short-term effects would be increased heart rate, increased cardiac output, and increased ventilation. For long-term effects, it would be muscle strength and endurance overall, reduced blood pressure in the long run, increased bone strength, reduced depression and anxiety, and mental clarity. Last but not least, we are to describe how to palpate the superficial arteries covered in this course to determine Victoria's pulse and heart rate. For the common carotid artery, it is located in our neck, and we can take the pulse using 2 fingers right here. And why we should only palpate one of these arteries at a time is because it can cause a loss of circulation to our head, which is not good. As for the brachial artery, it is under the biceps tendon, and it requires a little bit more pressure, so it would be located around here if you make a muscle. You can put 2 fingers here and feel under your bicep tendon, and you'll feel the artery. As for the radial artery, it is on the thumb side using 2 fingers, and so it would be around here. And you can apply a moderate pressure, but it is usually easy to find and to palpate. Now onto the lower extremity arteries. As for the femoral artery, as we can see here, it is a bit more difficult to find, but it would be in the inguinal ligament around the groin area. And it requires a little bit more pressure since you do have to dig around. For the popliteal artery, it is located behind the knee, as we can see here, and it requires usually a lot of pressure since it is usually hard to palpate and locate. It's usually not the first go-to, but it can, if found, it can be palpated. As for the posterior tibial artery, it is right behind the medial malleus and is very easy to palpate. You just apply gentle pressure with your 2 fingers, and you can usually feel the pulse right away. And lastly, for the dorsalis pedis artery, it is between the first and second toe, and usually requires very gentle pressure as well, and you can usually feel it pretty quickly. Here I also have the arteries located on the body here from figure 11, and that'll be all. Thank you.